Fractures, exercise, and bones. Adult bones do grow as a result of exercise. Interstitial bone growth occurs when chondrocytes expand within the cartilage and lead to bone growth. Weightlifting can promote bone density and lower the risk of osteoporosis by applying pressure to your bones. Under a microscope, it is possible to discern the cellulose bone, also known as a sponge bone, as a honeycomb or spongy appearance. The repeated stress that weightlifters' arms experience will lead to a more growth that compared to somebody who is a jogger. So I will believe that a weightlifter's arm bones will be heavier than those of a jogger. Adults should engage in at least 150 minutes of considerable cardiovascular activity and 75 minutes of aerobic activity, or a combination of the two each week. Optimally spread out over the course of a week or so, according to the American Heart Association. And it is recommended that children and teenagers ages 6 to 7 should engage in activity at least 60 minutes of moderate to intense physical activity each day. It is advised that adults increase their physical activity levels since their less active lifestyle enables relative fragile bones to deteriorate more quickly than those of children who often have a more active and stronger bones. Sedentarism and individuals who experience greater weightlessness or are confined to a bed have a higher risk of bone weakening and thinning compared to somebody who has a more active lifestyle. Someone who's bedridden can frequently lose a lot of their bone, which puts them at a greater risk of osteoporosis as well as fractures. Due to the lack of tension on the bones or a prolonged weightlessness seems to produce a lot of bone mass or cell growth disease. There is a cumulative decrease of bone mass as a result of fewer bone forming cells and a continual bone destroying interaction. By making an effort to be more active, such as exercising or moving about, these effects can be reduced. Osteoporosis is a bone condition that makes bones weak and frail. The current advice for those who have osteoporosis or are at risk of developing it is to exercise frequently and maintain an active lifestyle or getting physical therapy and vitamin D supplements. Because the hip carries a lot of the body's weight, it is a subject in adding additional stress. Individuals who do have osteoporosis are more prone to breaking their hip.